Tonight, community members and leaders mourn the loss of New Hanover County Commissioner Deb Hayes. She was elected as a county commissioner in 2020. A spokesperson for the county says she likely suffered from a massive heart attack over the weekend. We know this loss probably has a lot of people in our community thinking about their own heart health and the health of their loved ones. Joining me now is Dr. Linda Calhoun with Novant Health Heart and Vascular Institute to talk to us a little bit about heart health. Thank you so much for coming on this evening.
Thank you, Daniela.
So first things first, talk to me about heart health. What do we need to know? How important is it?
Well, there's some sobering statistics. 60 million women in the United States are living with heart disease, and 1 out of 5 women will actually die of heart disease. It's a leading cause of death in the United States for women and men. And a sobering statistic was that over 300,000 women in 2020 died from heart disease.
Wow, and a lot of times we don't know those statistics, so just putting that out shows you how important it is. Tell me some of the symptoms if you are feeling a heart attack coming on.
I think both men and women will feel chest pressure, chest tightness. It's really worrisome if it's been present for at least 2 to 10 minutes, but if it's lasting more than 15 minutes, of course you're worried about a heart attack. But women will present with more atypical symptoms as well. Some women have presented to me with shortness of breath, extreme fatigue, sweatiness, and 30% will have like indigestion symptoms. So it's important to be realistic about what your risks are as well.
And to avoid having any of those risks, how can we keep our heart healthy? What are some tips we can do?
I think the most important thing is knowing your risk factors. For example, one unmodifiable risk factor is family history. So if it runs in your family, you really should be aware that you are at risk. And then risk factors that we can treat are high blood pressure, high cholesterol, diabetes or pre-diabetes, being over our ideal weight, being sedentary, and of course stress and depression. I think that's really something important for heart attacks especially.
And a lot of times we often hear getting outside and exercising is good as well. Would you recommend that?
Absolutely, and I forgot smoking. Definitely smoking is something we need to avoid as well. So keeping at a healthy weight and knowing your numbers. I think what's important is that diabetes, hypertension, high cholesterol are silent killers, and we wouldn't know them unless we were getting proper screening.
All great tips. Thank you so much for coming on and telling us the importance of heart health and what we need to look out for and know.
Thank you.